Was that crack? Was that just the little bits of the skull?
Mm-hmm. So in terms of, I just want to see one leg, a foot.
That's the heart.
I think so, right?
Yeah.
Here's the heart.
Everyone's trying to get in on it.
My fingers will smush it if I try to.
You're trying to pick it up.
The heart is
You
right
found
there.
heart over there.
So what do they want brain?
Fascinating.
What do they do with
Yeah,
brain?
no. So brain, what you can do is with brain they.
Do people do stuff with eyeballs?
Oh yeah. Although eyeballs, they generally want more developed than this. And the cow, first there was brain in here.
Blasted out.
When they got blasted out with the water.
Well, you know, a lot of times, especially with the second tries, is we won't even put water because it's so big. You can just put your hand in there and pick out
Right,
the
and
parts.
just pick it up.
So I don't think they would be as war-torn.
Yeah, war torn. Oh dear.
Well, here's some organs for you. They're all attached. Here's the
Really?
stomach.
Oops, sorry, they both of you.
Kidney. Heart. I think it's the stomach.
Yeah.
A heart. And kidney and adrenal. I don't know what else is in there. Tiny.
Arms. I don't see the legs. Did you see any legs?
I didn't really look, but
Oh, there's some. Oh,
There you go. Yep. You got all of them right
And
there.
another boy. Another boy.
yeah, we usually see about 20, anywhere between 18 on a light day, but up to 25 patients a day. Obviously, not all in the gestational age that you're
Right.
interested in. But you want mostly over 14s?
Yeah.
When you're talking about an intact specimen, so how many of those do you see?
An intact
Yeah,
specimen?
within. So what's your volume on an average Tuesday?
With just second tries?
Mm-hmm.
Or maybe 5. So anywhere as low as 3 up to 7.
Okay,
Intact is probably less than 10%.
less than 10%.
We're not looking at things under the microscope too to see if
Right.
it's feasible or not.
Right.
So this is going to be naked eye determination, and so those kinds of things of what you're looking for. Obviously, you'd get trained. I don't know if I've ever seen a thymus, but maybe I haven't. I don't know. But I know I've seen livers, I've seen stomachs, I've seen plenty of neural tissue. We usually you can see the whole brain usually come out. So that's where we'd have to do a little bit of training with the providers on making sure they didn't crush.
Mm-hmm.
So would you call that intact?
These are intact kidneys,
Okay.
yes. If somebody needed.
Because if I looked at that, I'd be like, that's good to go.
Oh yeah.
That's like 21.
Yeah.
5 stars.
Yeah. You could start a neural cell culture from this neural tissue right here.
I don't
This-
even
this
at
is
11
definitely-
weeks, even though it's really early, because I know that's when we talked about
This is
second try.
neural tissue that people could take and look, and you see how it's still connected through the spinal cord back there. If you
We
even
just
pull
send
it
that all
close back.
together, and they pick it out? Or
You could actually, yeah. Some people prefer that actually because it keeps it a little more protected. Yeah. That 11.6 was pretty good. There was there was like 3 or 4 samples we could have taken out of the 11.6, so that would be if we were doing like 50 to 75 per specimen, that would be like 200, 300, right? And we'd be comfortable with that. But like so it's like stuff like this, like we don't want to do like just a flat fee of like 200 and then it's like
No, and I think the per item thing works a little better just because we can see how much we can get out of it.
Intact hearts these days because they're looking for specific nodes, AB nodes, SA. I was like, wow, I didn't even know. Good for them. Yesterday was the first time she said people wanted lungs. And then, but like I said, always as many intact livers as possible. People just want
livers.
Some people want lower extremities too, which that's simple. I mean, that's easy. I don't know what they're doing with it. I guess they want muscle.
Yeah, a dime a dozen.
That's an interesting concept. Let me explain to you a little bit of a problem, which may not be a big problem. If our usual technique is suction at 10 to 12 weeks, and we switch to using an iPass or something with less suction in order to increase the odds that will come out as an intact specimen, then we're kind of violating the protocol that says to the patient, we're not doing anything different in our care of you. And to me, that's a kind of a specious little argument, and I wouldn't object to asking Ian, who's our surgeon who does the cases, to use an iPass at that gestational age in order to increase the odds that he was going to get an intact specimen. I think, they're both totally appropriate techniques. There's no additional pain involved. I don't think the patients would care one iota. So I'm not making a fuss about that.
Okay. And are we agreed that $100 would keep you happy?
Well, let me agree to find out from other affiliates in California what they're getting. And if they're getting substantially more, then we can discuss it again.
Yes.
But the money is not the important thing.
No,
but it has to be big enough that it's
But
worthwhile
it
giving
is
the
something to
space
talk about. I mean,
It's been years since I've talked about compensation, so let me just figure out what others are getting, and if this is in the ballpark, then that's fine. If it's still low, then we can talk about it. I want a Lamborghini. I said I want a Lamborghini.
Don't we all, right?
Yeah, exactly.